my name is Meghan Blanusa, and I am a physical therapist at PTSMC's Naugatuck location and a proud graduate of Quinnipiac University's physical therapy program. I'm here to talk to you guys about temporomandibular dysfunction, which is something that I personally really like to treat. We're going to talk about what it is, some of the symptoms associated with it, and then how PT can help, in addition to a couple things you can try at home today to help manage your symptoms if you think this is something you might be suffering from. So temporomandibular dysfunction involves your temporomandibular joint, of which you have two, one on the right side and on the left side of your jaw. It involves two different bony structures. You have the mandibular condyle, which is part of your jawbone, and then the mandibular fossa, which is part of the temporal bone, which sits about here in your skull. In between those two bones, you have a disc, and then you also have a variety of muscles, which we call muscles of mastication, which essentially means chewing. And then you also have a variety of ligaments within that joint. When someone is having temporomandibular dysfunction, you can be having pain from any of those structures that I've just mentioned, or from a combination of those structures. Oftentimes with temporomandibular dysfunction, patients experience pain within the joint itself and also experience some associated symptoms such as clicking, popping, and grinding sounds whenever you go to open, close, or perform movements like chewing. You can also experience some limited motion. Most often we experience limitations with the opening motion of the jaw, but you can also have limitations with closing as well as side-to-side movements. You also can experience tenderness through those muscles of mastication that I mentioned before, and you can also have tenderness along the joint itself. There are another set of symptoms that we call secondary symptoms, such as headaches, earaches, head pain, and facial pain, along with neck pain that you can also experience. These symptoms often come around because of how close the jaw is located to the neck and head, and also from a shared neural structures that relays information from your jaw, your neck, and your head to the brain. And so sometimes your brain can simply just misinterpret where that pain is coming from and think it's coming from elsewhere instead of the temporomandibular joint. So with me now is one of our aides in our Naugatuck clinic, Jennifer. Jen's gonna help me demonstrate how posture and something called upper cross syndrome can affect temporomandibular dysfunction. Upper cross syndrome essentially talks about how muscles in the front and back of your spine can become either tight or weak depending on where they're located. Muscles, when they become either weak or tight, change the way they function and can affect the way that the joints in both your neck and your jaw operate, making it difficult for things to function optimally and then creating more pain and possibly factoring into why you're having temporomandibular dysfunction. I'm going to have Jennifer demonstrate how proper posture and poor posture can also affect the way that your jaw is allowed to open. So with proper posture, your jaw is in optimal alignment to allow for full opening of your temporomandibular joint. When you have poor posture, which essentially can come from slouching and rounded shoulders and a forward head, when you go to open your jaw, the joint changes and it's not able to open as fully as it normally would as if you were working with proper posture. The reason that this is important is because if the joint cannot open as optimally, the joint itself and the muscles of mastication have to work overtime to try to achieve that full range of motion of opening to allow for proper eating and chewing throughout the day. Approximately 50 to 75% of the population experiences symptoms of temporomandibular dysfunction at some point in their lifetime. Unfortunately, only 3 to 4% of those people actually end up seeking treatment. So you may be asking yourself, how can physical therapy help? Well, the first great step is calling one of our 29 clinic locations to set up that first evaluation with one of our trained clinicians. On day one for your evaluation, the clinician will take you through a variety of assessments looking at your posture, the way that your neck and jaw is moving, both overall in terms of range of motion and then also some smaller joint motions such as gliding, rolling, and sliding motions. And they'll also look at the strength of the muscles in your head and neck to see how things are working. After going through the evaluation process, your physical therapist will work with you to create an individualized plan to meet your current limitations and needs to help improve your temporomandibular dysfunction. This individualized plan of care will consist of some manual techniques performed by the therapist on you, some specific exercises to work on both the jaw and neck in terms of mobility and also strengthening, and some of our clinicians are even trained in trigger point dry needling to assist with any muscle issues that you might be having in those muscles of mastication. As mentioned previously, a couple easy things you can do at home now to try to modify these symptoms if you think you might be suffering from temporomandibular dysfunction are as follows. You can try working on proper tongue resting position. For most of us, when our mouth is closed, our tongue tends to sit in the bottom half of our mouth. Proper resting position is having the tongue at the roof of your mouth just behind your two front teeth. Working on this consciously throughout the day will eventually retrain your body to have your tongue rest there naturally without having to actively think about it. You can also make little habit changes such as modifying your diet to avoid chewy, crunchy, tough foods, or transitioning to a soft diet as a whole to decrease the amount of work that your jaw and muscles of mastication have to do to eat throughout the day. You can also adjust things such as sleeping position. In an ideal world, sleeping on your back keeps your spine in optimal alignment. However, this is not a comfortable position for most people. Other alternatives are side sleeping. In this position, you want to try to sleep on the side that you are not currently having pain on, and you want to ensure that the height of your pillow is just tall enough to allow for your neck to remain in good alignment with the remainder of your spine, so your head is not propped too far up or too far down. You can also try relaxation techniques using deep breathing, graded muscle relaxation, or even meditation. Lastly, a very commonly prescribed exercise program for temporomandibular dysfunction is called the Rockabato 6x6 program. If you think this is something that may be helpful to you, we have a handout online available for download with pictures and text explanations of how to perform each exercise. And again, if you think this is something you may be suffering from and want to learn more on how to manage your symptoms, please do not hesitate to call one of our offices and schedule your appointment today.